The focus of this project would be on schizophrenia, what the disease is, how it is portrayed in Hollywood movies, and whether or not these portrayals are accurate with how the actual disease presents itself. First, let's talk a little bit about my history. That's me holding my little sister who's wearing the pink. I've got the white shirt on. Ever since I was a little kid, psychology was interesting to me because I had a fellow classmate in kindergarten who was autistic. I knew that he was different from me, but I never perceived it in a negative way. As I grew older, films like A Beautiful Mind and One Flew Over a Cuckoo's Nest captivated me, and somewhat scared me that there were diseases like this out there that can take control of an individual at a later point in life. I soon became somewhat paranoid of potentially developing one of these disorders due to the fact that I may be subject to some of the horribly depicted psychiatric wards and some of the treatments that were performed in the movies. The lobotomy performed in One Flew Over a Cuckoo's Nest was particularly disturbing to me. I was reassured by my family that I would not get schizophrenia, as no one in our family had ever had a disease like that before. In middle school, a young autistic boy named Charles played on our soccer team with me and was really good. He actually ended up starting for the soccer team in my middle school after I'd gone on to play for my high school team. During my middle school and high school years, I fell in love with medicine and even had my father marry into a family in which my new step-grandfather was an extremely successful psychiatrist down in Florida. He talked a little bit about his work, and my interest grew even more from that point on. During college, I chose to pursue a degree in molecular biology, and my newfound knowledge of genetics has allowed me to view mental disorders in a different perspective. Specifically, I wondered how certain diseases could be genetically linked, or even be activated through epigenetic environmental factors. Also, I was curious about what I could do to help these individuals utilizing my degree. The next major question is, what is schizophrenia? Who gets the disease and what characterizes the disorder? Well, schizophrenia occurs in people from all cultures and walks of life. The disorder is characterized by a wide range of symptoms, including oddities in perception, thinking, action, sense of self, and manner relating to others. The hallmark of schizophrenia, however, is psychosis. Individuals who have schizophrenia typically suffer from delusions, which are erroneous beliefs that are fixed and firmly held despite clear contradictory evidence. Prominent delusions include that one's thoughts, feelings, or actions are being controlled by external agents, private thoughts are being broadcast indiscriminately to others, thoughts are being inserted into one's brain by some external agency, or that some external agency has robbed one of one's thoughts. Also common are delusions of reference, where some neutral environmental event, such as a song coming on the radio, has some personal meaning intended only for that person. Other strange propositions include delusions of bodily changes or removal of organs are also not uncommon. Also characteristic of the disease are hallucinations, which are sensory experiences that seem real to the person having it, but occurs in the absence of any external perceptual stimulus. Auditory hallucinations, such as hearing voices, are by far the most common. But other hallucinations, such as visual, olfactory, tactile, and gustatory, can also be present. Even deaf people with schizophrenia sometimes report auditory hallucinations. These individuals also display disorganized speech, in which the affected person fails to make sense, despite having correct syntactical rules governing verbal communication. The words and sentences that the affected person is using sound correct, but lack a meaning that the listener will understand. In other words, there seems to be no real point to what is being said. Also common to the speech of an individual with schizophrenia are neologisms, in which an individual makes up new words that do not exist. Also, these individuals have universally interrupted goal-oriented activities such as work, social relations, and self-care. Catatonia is another symptom, in which the patient may show virtual absence of all movement and speech and be what is called in a catatonic stupor. Now that we have a basic definition of what this disease is, the question needs to be asked. How is schizophrenia portrayed in Hollywood movies? Hollywood loves to use schizophrenics in the roles of killers and psychopaths on TV shows and scary movies. How many times have we watched movies in which a killer is captured only to blame their actions on the voices or that the voices told them to do it? Movies such as The Voices a black comedy starring Ryan Reynolds, portrays a murderer that is instructed to kill by the voices in his head, specifically his talking cat. This film joins a long line of inaccurate and misleading film portrayals that always gives schizophrenic characters certain stereotypical characteristics, such as them being violent. Movies that are examples of this are Nightbreed, a film made in 1990 in which a doctor gives drugs to a patient with schizophrenia and orders him to commit murders, which he does. In films like The Fisher King and Mr. Brooks, in which a man with schizophrenia commits mass murder. In Spider Force, a 2004 film about a patient with schizophrenia who is the main suspect of a series of murders as his fingerprints were found, but is too cut from reality to give his version of the account. And lastly, in The Messenger, the story of Joan of Arc, the main character, Joan of Arc, leads to war by following her hallucinations and has some symptoms of schizophrenia. This is the first and probably the worst major stigma labeled to those who have schizophrenia, because this can affect the individual's interaction with loved ones and friends. Friends and family may think this individual is a threat to them, and thus may be reluctant to interact with or help the individual. This belief is not supported by any statistical evidence, however, with most violent incidences connected with mental disorders are usually linked to substance abusers, typically those who abuse alcohol. The next major stigma is that drinking or substance abuse can cause schizophrenia, which research has proven to not be true. Although drinking and drug abuse can cause hallucinations, this is not the same thing as schizophrenia. In movies like In Santa Sangre, a boy experiments with drugs and prostitution, which leads to schizophrenia. In Nightbreed, again, the doctor drugs his patient, which leads to the onset of schizophrenia. In Kian, the main character experiments with drugs, which also leads to schizophrenia. A more recent example is the film In a Scanner Darkly. In the movie, a popular drug emerges in the United States which causes addicts to have schizophrenia. The stigma could be that the reason an individual has the disease is due to their substance abuse, and thus can make individuals think that they did it to themselves, or possibly that stopping the substance abuse will in turn stop the schizophrenia. We know that this is wrong. This is not a correct portrayal of schizophrenia, and it's definitely one of the worst stigmas to be placed on the disease. Another common stigma of schizophrenia portrayed in the movies is that the character had a troubled childhood before being diagnosed with schizophrenia. In Spider, the main character remembers a traumatic event, his father's murder, before developing symptoms of schizophrenia. In Karthik Calling Karthik, the patient had a troubled childhood where his brother died while trying to kill him, and reminiscing about that episode causes the onset of schizophrenia. Research shows that patients with schizophrenia have diverse backgrounds, some coming from wealthy families and happy childhoods, others having more disturbed childhoods and lower income families. Portrayals of troubled childhood being the direct factor causing schizophrenia can be misleading for families who may think that a traumatic event the patient experienced as a child is what caused the onset of schizophrenia. We do know that certain stressors may be linked to the expression of the disease, but this does not mean that a child with no stress will not eventually develop schizophrenia due to their genetic predisposition to the disease. So what is the overall depiction of schizophrenia, and how is it incorrect? Well, schizophrenia does not typically manifest itself in a violent, combative form. While hallucinations and delusions are a hallmark of the disease, these typically do not render an individual to behave the way that they are portrayed in horror films, such as mass murderers, killers, or simply violent individuals. Substance abuse, while some schizophrenics may be alcoholics or other forms of substance abusers, the substance abuse itself does not cause the disease, as well as traumatic events. Traumatic events in no way cause schizophrenia. Piggybacking off of what I just said, a study found that movies produced between 1990 and 2010 found that over 80% of main characters with a diagnosis of schizophrenia displayed violent behavior, and nearly a third engaged in homicidal behavior. This is a really bad portrayal of the disease. However, there have been a few films that have made a more realistic depiction of the disease. For example, mental health experts are applauding A Beautiful Mind for creating a better understanding of schizophrenia, although some say the Hollywood version of John Nash's life does sometimes take liberties with the medical realities. In the movie, Russell Crowe plays John Nash, a brilliant mathematician who came up with the game theory of economics and won the Nobel Prize decades later in 1994. At age 31, he develops schizophrenia and suffers a mental breakdown. Because of his hallucinations and bizarre behavior, Nash is eventually placed on antipsychotic drugs. But in the film, he stops taking the drugs after finding that they dull his senses, emotions, and sex drive. Instead, he gets a handle on the disease through sheer force of willpower. Dr. Ken Davis, chairman of psychiatry at Mount Sinai School of Medicine in New York, told ABC News that Crowe does a brilliant job of portraying the mannerisms and some of the behaviors of a schizophrenic, the best I've ever seen on screen. On the other hand, the notion that willpower can really overcome schizophrenia is ludicrous. So, the question remains to be answered. What can we do to turn these inaccurate depictions of those with schizophrenia around? The easiest way to address this question is to start off with large established groups. Groups such as SARDA, which stands for Schizophrenia and Related Disorders Alliance of America, work to not only improve the lives of those with schizophrenia-related brain illness, but to help reduce stigmas associated with the diseases. Well-established groups like these are the best starting place to start to change the stigma surrounding schizophrenia today. I believe that the most important thing that needs to be done in terms of reducing the stigma of affected individuals is education and raising awareness. This is much easier said than done, but educating and incorporating more mental health awareness, specifically in children and young adults, will force certain depictions of individuals in movies to be changed. This can be seen in the efforts undertaken in the women's rights movement that has been happening since 1848 to 1920. Women used to be portrayed as hopelessly stupid and could not function without following the direction of a man in many movies. Today, in 2016, if a movie portrayed women in this light, the movie would receive massive criticism and may cause the producers to lose lots of money through boycotts and other reasons like that. This has largely changed the way women are depicted and consequently has reduced this stigma in our society. The schizophrenia groups campaigned and made society more aware of the truths of the illness. This could result in more media attention and boycotting of movies that portray mental illness in the incorrect light. This in turn has a reinforcing effect by educating more people about the illness who go see the movie and it's portrayed in the correct way. Hollywood movies have a massive influence on culture, not only in the United States, but all over the world. With more accurate depictions of those with mental disorders, this may also get more people involved in volunteering for advocacy groups and getting more people involved in mental health care. Getting media attention on important issues such as these can mobilize populations to make change on a societal level. Yet another great example of this is the recent news that Bruce Jenner had gender identity disorder and decided that he identified as a female. This sparked a national debate, which has drastically reduced the stigma for those with this disorder, even sparking TV shows such as I Am Jazz, which follows the life of a transgender girl who identifies as female but was born as male. Educational initiatives are now being mobilized, and the level of understanding on this issue is much better since it has been in the limelight. Imagine the level of understanding and change that could occur if certain Hollywood stars or a major motion picture depicted schizophrenia in a way that sparked a conversation about the disease at a national level. We could see not only the stigma disappear, but also we could see an increase in the funding for treatment, as well as research on the disorder. This could subsequently lead to improved medications and perhaps even future genetic therapies that could cure the disorder. Overall, the message here is clear. One of the best ways to get rid of the stigma, as well as increase national awareness and funding for schizophrenia, would be to have large advocacy groups like SARDA work with Hollywood to illuminate the issues with the disease correctly, and by doing so, subsequently educate all of America and potentially the rest of the world about the disease. Lastly, I would just like to apologize for the poor sound quality on this presentation. I'm using a very old computer, and I'm talking actually, even though it doesn't sound like it, fairly loud, and there's just nothing I can do to make it louder. This is the first time I've had to make a presentation like this, so I hope you enjoy. Thank you.